An overhead view of an operating room table, the patient on it weighs 600 grams, less than 2 cans of soda. A radiant warming lamp hangs from the ceiling on a swing arm. It is keeping the infant at 36.5 degrees Celsius. The room is at 28 degrees for the staff. The suture in the surgeon's hand is 6-0, finer than a human hair. The bowel he is repairing is the diameter of a piece of pencil lead. The road from medical school to this table takes 13 years. Level 1, medical student. Tuition is $60,000 a year. Living expenses are another $30,000. By the end of MS4, your principal alone is $223,000. The AAMC mean for the class of 2025. The interest meter started running the day you matriculated. It does not pause for clinical rotations. MS1 and MS2 are textbook years. Anatomy lab is in the basement of the medical school building. A formalin smell follows you home in your hair. You learn the brachial plexus on a cadaver named Robert, who donated his body the year before. The instructor never says his first name out loud. Step 1 is pass-fail. You take it after MS2, and the number stops mattering. Step 2, CK comes after MS3. 9 hours, up to 318 multiple-choice questions, taken on a Saturday in June. Score release is 4 weeks later. That number is the one surgery programs read first. MS3 is rotations: internal medicine, pediatrics, family, then surgery. The surgery clerkship is 6 weeks. You wake at 4:30 a.m., pre-rounds on 3 patients before the team gathers at 5:30. The OR starts at 7. The first case is a Whipple, a pancreaticoduodenectomy on a 68-year-old with a head of pancreas tumor. You scrub in for the 3rd time in your life. The PGY-5 lets you hand tie deep in the abdomen on a vessel ligature. 3 throws with 3-0 silk. Your hands shake on throw 1 and steady by throw 3. The attending nods once. That night, in the library, you look up general surgery residency for the first time. A week later, you scrub a pyloromyotomy on a 6-week-old with projectile vomiting. The pediatric surgeon hands you a pickup the size of tweezers. The infant's stomach is the size of a walnut. The cut into the pylorus muscle is 2 centimeters long. You don't say much for the rest of the case. The classmates who ranked dermatology will be attendings in 5 years. You will still be a PGY-3. You don't know yet that the pyloromyotomy case is going to be one of the first solo operations you do as a fellow, 6 years from this morning. Match day, you rank general surgery. Level 2, general surgery intern, PGY-1. Salary is $68,166. The AAMC mean for July of 2025. Hours are 80 per week on paper, 90 on the bad ones. Your loan principal is now $228,000 and climbing. Orientation lasts a week. You get a pager, a long white coat, a hospital ID, and an EMR login. By Sunday night, you have memorized the floor extensions. By Monday morning, you are alone on the surgical floor with 22 patients on your list. Step 3 sits in the back of intern year. 2 days. Computer-based case simulations on day 2. You sit for it in March on a vacation week and pass. The certificate arrives in a cardboard tube and goes in a drawer. It is the last federal exam. Every test for the next decade is run by the American Board of Surgery. 3 a.m. The surgical floor pages. A post-op colectomy patient is tachycardic at 140, and his blood pressure is 80/40. You walk in with 1 year of clinical training and a single cup of soup in your stomach. The abdomen is rigid. You order a stat lactate, 2 units of blood, and call the senior. She is in the OR with a perforated viscus. She answers on speaker. What do you think it is? Anastomotic leak. Go. The patient is on the table in 20 minutes. He survives the night. You round on him at 7 a.m. and the EMR tells you his hemoglobin is stable. You sit on a stretcher in the hallway and eat the 2nd cup of soup of the shift. The first time you close skin solo on an appendectomy is at 1 a.m. in month 4. Your senior signs the operative note without changing a word. You walk out of the OR and the lobby is empty. In February of intern year, your chief pulls you aside on a quiet Sunday. She asks where your head is. You say pediatric surgery. She says, find the lab now. Not later. The Pediatric Surgery Match rewards research. Without a lab year and a first author paper, you don't get an interview. You take her advice that week. 4 more years on the service. Level 3, General Surgery Resident, PGY2 through PGY5. Salary climbs from $70,000 at PGY2 to $82,000 at PGY5. Loan principal is now $238,000. AB site every January, 5 hours, 250 multiple choice questions. Your percentile follows you across the application cycle. After PGY2, you step out of the OR for 2 protected research years. Your lab gives you a mouse colony, an IRB application, and a desk near the window. 24 months pass. You scrub on nothing. The co-residents from your intern class become senior. They send you photos from the OR lounge. You answer with photos of mouse cages. The lab director is patient. The PI is impatient. The mice die, and you start over. A first author paper lands in the Journal of Pediatric Surgery in month 19. Intestinal ischemia in a neonatal model. Your name is first. Your PI introduces you to your first APSA poster session at the national meeting. You stand by the poster for 3 hours and explain Figure 2 to a senior pediatric surgeon from CHOP who asks 2 questions and walks away. You don't know yet that the same surgeon will write your fellowship recommendation letter in 3 years. Back to clinical PGY3. You stop apologizing for the 2-year gap on your CV. The Pediatric Surgery Match is run through the NRMP Specialties Matching Service. 46 active programs in the country, about 47 spots a year. Applications open in the fall of PGY5. Interviews happen in the winter. Match day is in late April. In the 2024 cycle, 68 applicants competed for 49 filled positions. 27.9% did not match. Some reapply the next year, some pivot to MIS or colorectal because the second try also fails. The night before match day, you do not sleep. After PGY5, you sit the ABS General Surgery Qualifying Exam, 8 hours, written. Pass it, and you are board eligible in general surgery. The night you finish, you and 3 co-chiefs go to a bar across from the medical center and split a check. As PGY5, you also run a code blue in the SICU without an attending in the room. ROSC at 3 minutes. You walk out, and the charge nurse says, "Nice work, Chief." First time anyone has called you that. Match day. You open the email at 11 a.m. Level 4, Pediatric Surgery Fellow, PGY6 and PGY7. Salary is $84,700 at PGY6, $89,000 at PGY7. The AAMC means for the 2025 academic year. 2 boards bracket the fellowship. In the fall of year 1, you sit the ABS General Surgery Certifying Exam. 3 30-minute sessions, 12 cases, 2 senior examiners per session, conducted virtually. You pass and you are board certified in general surgery. In the spring of year 2, you sit the PSQE, the Pediatric Surgery Qualifying Exam multiple choice 1 day. The oral component, the PSCE, waits for you after fellowship. 2 a.m., the NICU pages. A premature infant born at 24 weeks gestation, now weighing 1.2 kilograms, has bowel changes on serial exam. Distension, free air on the cross-table X-ray. NEC perforation, necrotizing enterocolitis, XLAP, now. You walk into a neonatal OR that runs at 28 degrees Celsius for the staff and 36.5 for the patient. A radiant warming lamp hangs from a swing arm above the table. The infant is wrapped in sterile surgical wrap with a window cut over the abdomen. The instruments on the Mayo stand are the size of pens. The suture is 6-0. You can't see it well without loupes. You open. The bowel is the color of port wine. The attending stands across from you. Together you decide what is salvageable. You resect 40 centimeters of necrotic bowel and leave a stoma. The infant survives the night. By morning rounds, her lactate is trending down. She is still intubated through a 3-millimeter endotracheal tube. She will never know your name. The procedure note will go in her chart and stay there for the rest of her life. If anyone asks her in 20 years who did her bowel resection, she will not have an answer. The reward, if there is one, arrives in about 18 months as a toddler running across the clinic floor. You will probably not be there to see it. The call schedule is every other weekend in-house for 24 months. Your spouse plans dinners around it. Your friends stop asking. Your attending's office wall is covered in photos, kids at kindergarten graduations, a wedding invitation, a toddler in a backyard. Each photo has a date and a diagnosis written on the back in blue pen. The earliest one is from her first year as an attending. She tells you the first photo went up after a Kasai patient she operated on as a 40-day-old came back at age 4 with a drawing for her. She kept the drawing too. It is in the desk drawer. She still doesn't show people. 2 years, then it is your name on the consent. Level 5, Junior Attending Pediatric Surgeon. Year 1 through 4, $350,000 to $500,000 a year for new attendings. Doximity's 2024 mean for the specialty. All experience is $647,000. The PSCE is your final board, the Pediatric Surgery Certifying Exam. Oral, 5 30-minute sessions, 1 day, conducted virtually by senior pediatric surgeons. You sit it after fellowship. The window to pass is 7 academic years. Pass it, and you are board certified in pediatric surgery. The most specialized surgical certificate the American Board of Surgery issues. Most pass on attempt 1. 4 a.m. The phone rings. A 12-day-old with bilious emesis is in your ED. The CT shows malrotation with midgut volvulus. OR now? You drive in. The route is automatic by month 6. Same exit, same parking lot, same elevator. You position the radiant warming lamp yourself this time. The attending who used to stand across from you is now you. The LADS procedure runs 48 minutes. Divide the bands, broaden the mesenteric base, appendectomy. Run the bowel from ligament of Treitz to ileocecal valve. The infant goes back to NICU pink and feeding by post-op day 3. You walk out of the OR at 6:15 a.m. and round on the rest of your service by 7. Your first case as primary surgeon where it goes wrong is in month 7. A gastroschisis silo reduction in a 1.8 kilogram newborn. The bowel does not pink up after closure. You take the infant back at 12 hours. The parents are in the family room. Both are crying before you finish the first sentence. The Morbidity and Mortality Conference the next Thursday is your case. The senior attendings ask the questions everyone asks. You go home and don't sleep. The on-call pattern is concentrated. 1 week on, then 3 or 4 off. On-call weeks include night call roughly every 3rd night. The hospital is 40 minutes from your house. You keep an overnight bag in the trunk. The first photo arrives in the mail in month 9. A toddler standing in a backyard holding a plastic shovel. The mother wrote on the back. She just took her first steps last week. The diagnosis line reads Kasai, biliary atresia, operated at 7 weeks. You remember the case. You tape the photo to the wall behind your desk. 1 photo. The wall starts. By month 14, you have 8 photos. By the end of year 2, 19. By the end of year 4, 32. Most kindergarten pictures, 1 Christmas card, 1 drawing in crayon from a Kasai patient who is now in 2nd grade. 5 years, then 10. Level 6, Senior Attending, Division Chief. Year 18, $600,000 to $900,000 a year. AAMC tracks chief as a separate faculty rank. The American Board of Surgery moved to continuous certification, a short online assessment every 2 years instead of a decennial exam. You log CME hours on the same cycle. Every 2 years, your hospital re-credentials your privileges line by line. The privilege form is 2 pages long for a pediatric surgeon. Kasai, LADS, gastroschisis closure, ECMO cannulation, fetal MMC repair, if you have the privilege. By year 10, you stop operating on everything. You are known now for one thing. Some chiefs are known for neonatal colorectal, some for fetal surgery, some for surgical oncology. You picked yours by year 10, and you have not strayed since. The department asks you to be division chief in the fall of year 18. You take it. You operate 1 day a week now. The other 4 are budget meetings, recruitment, ECMO coverage politics, and OR block time negotiation with the orthopedic chief. On your one OR day, the radiant warming lamp is still over the table. The fellow positions it now. You stand across from her, the way your attending stood across from you 20 years ago. She is fast. You do not say much. The case today is a lad's on a 14-day-old. The fellow gets the cannulation on attempt 1. The duodenojejunal junction comes up without her asking. She closes in interrupted 40 PDS. At the end, she glances up at you once. You nod the way you were nodded at, on a Whipple, in MS3, 23 years ago. Most weeks you operate 4 hours, some weeks 0. The orthopedic chief operates 20 hours a week and earns $500,000 more than you do. You knew this when you took the chief job. You took it anyway because someone has to recruit the next pediatric surgeon, and most surgeons hate that work. The wall behind your desk is full. Some photos are from kids who are now in college. One is a wedding invitation. The bride, a former Hirschsprung's patient you operated on at 9 weeks. The fellow you trained 3 years ago calls you on a Friday afternoon. She just got her first photo in the mail. She tells you the diagnosis: gastroschisis, primary closure, year 1 of her attending career. You congratulate her. You hang up and look at the wall. It started with 1 photo. There are 42 now. 6:30 p.m. The clinic is dark. The senior attending's office is dark except for the desk lamp. The wall of photos is lit. The fellow she rounded with that morning is in the NICU finishing her last note. Tomorrow's OR list is printed and on the desk. 3 cases. First one at 7:30 a.m., a 4-day-old with gastroschisis, a 5-month-old with Hirschsprung's pull-through, a 6-year-old with a Wilms tumor resection. The warming lamp will click on at 7:15. The 6-0 suture will come off a sterile tray. The patient on the table will weigh 1.8 kilograms. None of the 3 patients on tomorrow's list will remember any of it. Some of them will write back in 20 years. The road to this room took 13 years. The wall has 42 photos on it. The wall might have 1 more by the end of this year, or it might not. Either way, the lamp clicks off tonight at 6:31. Tomorrow at 7:15, it goes back on.